Imagine a situation where someone struggling deeply with their mental health finds themselves caught in the criminal justice system. The traditional path often involves jail time, which for many exacerbates their issues and makes it even harder to reintegrate into society. It's a cycle that seems designed to fail, leaving individuals more vulnerable and communities less safe. But what if there was another way? What if the court system itself could become a place of healing and support rather than just punishment? This isn't a hypothetical question. It's the driving force behind mental health courts, or MHCs. These specialized judicial programs are designed to address the unique needs of individuals whose mental illness has played a role in their involvement with the law. Their overarching goal is profoundly important: to reduce reoffending by steering eligible participants away from punitive pathways and into supervised treatment and robust support systems. Today, we're going to explore what mental health courts are, how they work, and most importantly, what the evidence tells us about their actual impact on reducing reoffending. This topic remains crucial in our ongoing conversations about justice reform, community safety, and how we, as a society, support our most vulnerable members. It's a complex area, full of hope, but also significant challenges, and understanding it requires a balanced perspective. Mental health courts emerged as an innovative alternative to the conventional justice system. They embody what's known as therapeutic jurisprudence, a fancy term for a simple idea: that the law itself can be a force for positive change in people's health and behavior. Rather than just determining guilt and handing down sentences, these courts aim to improve psychiatric functioning, enhance public safety, and ultimately improve the quality of life for participants, all while striving to reduce recidivism. That's the term for reoffending. At their heart, MHCs are built on a few core concepts. Firstly, there's diversion. This means moving individuals with mental illness away from jail or prison and into community-based treatment. Think of it as a detour from a dead-end street onto a road that leads to recovery. Secondly, they use a multidisciplinary team approach. This isn't just a judge, a prosecutor, and a defense attorney. It's a collaboration that includes probation officers, mental health clinicians, and case managers, all working together to craft and monitor individualized treatment plans. It's like having a dedicated support squad. Participation in these courts is typically voluntary, though we'll discuss the nuances of that voluntary aspect later. Once enrolled, participants receive intensive supervision and case management. This isn't just a one-time therapy session. It means ongoing community-based treatment, access to social services, and regular check-ins with the court to monitor their progress. Finally, there are eligibility criteria. Generally, these courts are for individuals whose demonstrable mental illness is linked to their illegal behavior, sometimes including co-occurring substance use disorders. While often focused on nonviolent misdemeanors, some courts have expanded to accept felony or even violent charges, reflecting the evolving understanding of mental illness's role in criminal behavior.
So, how do mental health courts actually work to reduce reoffending? Their effectiveness is primarily attributed to a comprehensive, multi-pronged approach. First, they provide intensive treatment services, targeted mental health support, and often substance use treatment, addressing the root causes of problematic behavior. Second, there's comprehensive case management, which is about coordinating all the different services and supports a person might need, from therapy to medication management. And crucially, they provide access to vocational and housing support. Because, let's be honest, it's incredibly hard to focus on your mental health if you don't have a safe place to live or a way to earn a living. Addressing these underlying social determinants is critical to breaking the cycle of reoffending. The data often shows a clear link. Program completion in an MHC is strongly associated with a lower likelihood of recidivism. This makes intuitive sense. When people receive the support they need to stabilize their mental health, secure housing, and find purpose, they are far less likely to return to behaviors that lead them back into the justice system. Many different organizations contribute to the operation and study of these courts, from judicial systems and mental health professionals to government bodies and advocacy groups, like the American Psychiatric Association and Mental Health America, all seeking to understand and refine their impact. However, despite their promise and recognized potential, mental health courts are also subjects of significant debate and scrutiny. It's important to examine these controversies with the same balanced and evidence-informed approach we apply to their benefits. One of the primary areas of contention is their effectiveness and research limitations. While many studies do indicate reduced reoffending, some comprehensive meta-analyses suggest only a small effect or a moderate reduction. Critics point to inconsistencies in how different MHCs operate and methodological limitations in research, questioning precisely how and why MHCs achieve their goals, and for whom. It's not enough to say they work. We need to understand the mechanisms. Then there's the concern about the stigmatization of mental illness. Do MHCs, by their very existence, inadvertently reinforce a link between mental illness and criminality? Some argue that by creating a specialized court for individuals with mental health issues, we might unintentionally further entrench the idea that mental illness makes someone inherently dangerous or more likely to commit crimes, exacerbating existing societal stigma. Another significant debate revolves around addressing systemic issues versus individual treatment. While MHCs excel at providing individualized treatment, critics argue they often don't adequately address the broader systemic issues that contribute to the overrepresentation of people with mental illness in the criminal justice system. Things like chronic underfunding of community mental health services, lack of affordable housing, and inadequate support systems. These are societal failures, not just individual ones. Focusing solely on individual treatment without pushing for larger structural changes might be missing a crucial piece of the puzzle. There's also the criminalization hypothesis debate. Is untreated mental illness a direct cause of criminal offenses, or are other factors often more significant drivers? Critics suggest that while mental illness can certainly play a role, other psychological factors such as antisocial ways of thinking or socioeconomic conditions like homelessness and poverty are often more direct catalysts for involvement in the justice system. It's a complex interplay, not always a direct causal link.
The issue of coercion and true voluntariness is also a thorny one. While participation in an MHC is nominally voluntary, defendants may feel immense pressure to participate. The alternative could be a much harsher sentence, or for many, the inability to access vital mental health services that are otherwise unavailable in their community. Is it truly voluntary if the consequences of saying no are so severe? Equity, access, and selection bias are also major concerns. Studies show disparities in who gets access to these courts. Certain demographics, such as younger males, indigenous individuals, or those with co-occurring substance use or personality disorders, are often less likely to be granted diversion. Complex selection processes can inadvertently lead to bias, limiting who benefits, and potentially skewing the positive outcomes reported. Finally, there are debates about the scope of offenses and system expansion and the resource intensity and scalability of MHCs. Some worry that these courts could be used to criminalize lifestyle offenses, particularly those related to homelessness or addiction, thus expanding the reach of the criminal justice system rather than genuinely diverting individuals away from it. And while effective, MHC programs are often expensive and incredibly resource-intensive. They serve only a small percentage of the large population of individuals with serious mental illness involved in the justice system, raising questions about their scalability and whether their high cost could be better invested in broader community mental health services. Looking ahead, the future of mental health courts will undoubtedly involve continued efforts to refine their design and implementation, directly addressing these identified controversies. This means focusing on robust research methodologies to clearly delineate the mechanisms through which recidivism reduction actually occurs, and for whom. It also means navigating the ethical complexities of true voluntariness and guarding against potential stigmatization. There will likely be an ongoing push to integrate MHC principles with broader reforms that prioritize truly accessible, comprehensive, community-based mental health services. This wider lens helps to address the systemic injustices that often bring individuals into the criminal justice system in the first place. Additionally, debates surrounding the appropriate scope of offenses, ensuring equitable access for all who need it, and the scalability of these resource-intensive programs will continue to shape their evolution. Mental health courts represent a vital step forward in reimagining justice. They embody a compassionate approach, recognizing that individuals struggling with mental illness often need treatment and support, not just punishment. While their successes are clear, their complexities and limitations are equally apparent. The journey to truly reduce reoffending and create a more just and humane system for everyone means we must continue to critically evaluate these programs, asking tough questions, advocating for systemic change, and ensuring that mental health is always seen as a pathway to recovery, not a sentence for life.